Which of the following patients should the nurse assess first? A. A 45-year-old with COPD complaining of shortness of breath. B. A 55-year-old post-op with a BP of 90-60 mm Hg. C. A 30-year-old with a fractured arm reporting 7/10 pain. D. A 70-year-old with dementia asking where the bathroom is. Answer B. A 55-year-old post-op with a BP of 90-60 mm Hg. Rationale: low blood pressure in a post-op patient could indicate hypovolemic shock, which requires immediate attention. ABCs: airway, breathing, circulation. Prioritize circulation in this case. A nurse is caring for a patient with diabetes mellitus who is confused and diaphoretic. What should the nurse do first? A. Administer insulin. B. Check blood glucose. C. Give the patient a glass of orange juice. D. Notify the healthcare provider. Answer: check blood glucose. Rationale: always assess blood glucose first to confirm hypoglycemia before initiating treatment like administering orange juice or insulin. Shark 3. The client with heart failure is prescribed furosemide. Which lab result should the nurse monitor closely? A. Sodium level. Potassium level. C. Calcium level. D. Chloride level. Answer: B. Potassium level. Rationale: furosemide is a loop diuretic that can cause potassium loss, leading to hypokalemia. Monitoring potassium levels helps prevent complications like arrhythmias. 4. Which finding in a patient with pneumonia requires the nurse's immediate intervention? A. Crackles in the lung bases. B. Coughing up yellow sputum. C. Temperature of 101 degrees Fahr, 38.3 degrees Celsius. D. Respiratory rate of 32 breaths per minute. Answer: D. Respiratory rate of 32 breaths per minute. Rationale: a high respiratory rate indicates respiratory distress, which needs immediate intervention to prevent further complications like respiratory failure. 5. The nurse is caring for a patient receiving heparin therapy. Which lab value should be monitored to assess the effectiveness of the therapy? A. Platelet count. B. Hemoglobin. C. Activated partial thromboplastin time, APTT. D. Prothrombin time, PT. Answer C. Activated partial thromboplastin time, APT. Rationale: heparin therapy is monitored by APTT. A prolonged APTT indicates effective anticoagulation, but it should remain within therapeutic ranges to prevent bleeding. 6. A client is admitted with dehydration. Which IV fluid would the nurse anticipate administering first? A. 0.9% normal saline. B. 0.45% normal saline. C. 5% dextrose in water. D. 3% sodium chloride. A. 0.9% normal saline. Rationale: 0.9% normal saline is an isotonic fluid that replaces extracellular fluid volume without causing a fluid shift, making it the preferred choice for rehydration. 7. A client with a history of chronic kidney disease has been prescribed Epoetin alfa. Which of the following is the priority assessment? A. Temperature. B. Blood pressure. C. Skin turgor. D. Bowel sounds. B. Blood pressure. Rationale: Epoetin alpha can cause hypertension due to increased red blood cell production. Monitoring blood pressure is crucial to prevent complications such as stroke. A nurse is teaching a client with newly diagnosed hypertension about lifestyle changes. Which statement by the client indicates the need for further teaching? A. I will reduce my sodium intake to help lower my blood pressure. B. I will start exercising 30 minutes a day, 5 days a week. C. I will take my medication only when my blood pressure is high. D. I will monitor my blood pressure regularly at home. Answer: C. I will take my medication only when my blood pressure is high. Rationale: hypertension medication should be taken consistently as prescribed to maintain control of blood pressure, not just when it's elevated. This statement indicates a lack of understanding. 9. A client with a history of deep vein thrombosis, DVT, reports sudden shortness of breath and chest pain. What is the nurse's priority action? A. Administer oxygen via nasal cannula. B. Check the client's blood pressure. Contact the healthcare provider immediately. D. Place the client in a semi-Fowler's position. Answer A. Administer oxygen via nasal cannula. Rationale: the symptoms suggest a possible pulmonary embolism. Administering oxygen improves oxygenation, which is the immediate priority, while further interventions are planned. A nurse is preparing to administer digoxin to a client with heart failure. Which assessment finding would require the nurse to hold the medication and notify the healthcare provider? A. Heart rate of 58 beats per minute. B. Blood pressure of 110/70 mmHg. C. Potassium level of 4.0 mmHg per B. D. Respiratory rate of 16 breaths per minute. Answer: A. Heart rate of 58 beats per minute. Rationale: digoxin slows the heart rate, and it should be held if the heart rate is below 60 beats per minute to avoid severe bradycardia. The nurse should notify the healthcare provider before administering the medication.